Top 13 causes of hemorrhoids and what to do. Today, we'll dive into the world of digestive health, unraveling a topic that affects millions of people around the globe, but is often overlooked: hemorrhoids. This issue, although common, carries a stigma that prevents many from seeking the right solutions. The key to effective prevention and treatment lies in simple daily habits, which can make all the difference in your quality of life. From the vital importance of hydration to the impact of stress on your digestive health, we'll explore the causes, preventions, and treatments for hemorrhoids. But did you know something as simple as your posture throughout the day could be contributing to this problem? And how do diet and physical exercise fit into this equation? Did you know the way you sit on the toilet to defecate can have a significant impact on your hemorrhoids? Find out why this seemingly harmless habit can be harmful. Finally, discover why ignoring certain signals from your body might be putting you at risk. Stay with us to unravel these mysteries and learn how to better take care of your health. Let's go! The top 13 causes of hemorrhoids are: 1. Inadequate hydration. Hydration is crucial for digestive health, especially regarding the prevention and treatment of hemorrhoids. Consuming an adequate amount of fluids daily helps to keep the stools soft, facilitating their passage through the intestine and reducing the need for straining during defecation. This decreases the pressure on the veins in the anal region, significantly contributing to the prevention of hemorrhoids. What to do? It is recommended to drink at least 8 glasses of water per day, along with the intake of other healthy fluids, such as teas and natural juices, avoiding alcoholic and caffeinated beverages that can promote dehydration. 2. Obesity. The relationship between excess weight and the development of hemorrhoids is complex, involving both the physical impact of increased abdominal volume and associated lifestyle habits. A sedentary lifestyle combined with a diet high in fats can lead to constipation, as these factors contribute to reduced bowel movements. This scenario favors the occurrence of evacuation difficulties, putting more pressure on the anal region and ultimately resulting in the emergence of hemorrhoids. Therefore, the interaction between diet, physical activity, and digestive health plays a crucial role in the prevention and management of this condition. What to do? Reaching the ideal weight is highly recommended, and for this it is advised to adjust the diet, practice daily exercises, being followed by an endocrinologist and a team of health professionals. 3. Not defecating when feeling the urge. Hesitating to heed the natural call to defecate can lead to digestive complications, specifically resulting in drier and harder stools. This postponement can cause significant abdominal discomfort and, as a result, make evacuation even more difficult. This process is a common cause of constipation, a state characterized by persistent difficulty or the inability to defecate regularly. This condition not only affects physical well-being, but can also contribute to the development of additional problems in the digestive tract, underlining the importance of promptly responding to the body's signals to maintain digestive health. What to do? The most important tip is to defecate whenever you feel the need, because that is the most appropriate time to evacuate without having to make much effort. 4. Working standing or sitting. Staying too long in the same position, whether sitting or standing, increases the pressure on the pelvic and anal veins, contributing to hemorrhoids. The body weight in sitting positions directly presses on the hemorrhoidal veins. Moreover, staying too long without changing position can restrict blood flow, causing blood to accumulate in the veins, which expand and can form hemorrhoids. Constipation, more common in those who sit for long periods, requires extra effort when evacuating, increasing the pressure on the veins and the risk of hemorrhoids. Poor posture, both sitting and standing, also increases pressure on these veins. What to do? A good solution for this case is to perform stretches every 2 hours. You can also perform pelvic floor strengthening exercises, maintaining the contraction of the perineum when standing. To perform this perineum contraction is recommended to imagine that you are sucking something with the vagina or anus, for example. Another indication is to practice exercises regularly. 5. Low-fiber diet. Adequate fiber intake is essential for digestive health, as it helps regulate bowel movements. A diet low in fiber can cause a reduction in bowel movements, leading to drier and harder stools. This situation, in turn, can cause discomfort and pain during evacuation. What to do? The solution to this is to increase the intake of fiber-rich foods, such as whole grains, leafy vegetables, and fruits with skin. 6. Chronic diarrhea. Chronic diarrhea, defined by a high number of daily evacuations that persist for more than 10 days, can lead to the development of hemorrhoids with anal bleeding. This state, resulting from increased pressure on the anal musculature due to the excess evacuations, emphasizes the interconnection between prolonged symptoms and additional complications in the anal region. What to do? The key is to regulate the bowel. People who have soft stools or diarrhea frequently need medical evaluation because they may have diseases such as irritable bowel syndrome, for example. 7. Pregnancy. During pregnancy, the occurrence of hemorrhoids is a common occurrence, mainly due to increased body weight, greater pressure in the pelvic region, and constipation. These are physiological changes typical of the gestational period. The combination of these factors contributes to increased pressure on the veins in the anal region, facilitating the appearance or worsening of hemorrhoids. Therefore, understanding these changes and adopting measures to mitigate their effects, such as maintaining a balanced diet and practicing appropriate exercises, can help the pregnant woman better manage this common discomfort of pregnancy. What to do? It is important to avoid constipation, walk, drink plenty of fluids, and defecate whenever you feel the need. 8. Advanced age. Hemorrhoids, although they can occur at any age, are more frequent from the age of 45 because the tissues that support the veins of the rectum and anus weaken and stretch with aging. Moreover, a person who has had a hemorrhoidal crisis has a higher chance of having a new crisis. 9. Diet rich in spicy or heavily seasoned food. Frequently consuming spicy or excessively seasoned foods can contribute to the irritation and inflammation of hemorrhoids, exacerbating discomfort. Similarly, the abuse of alcohol consumption is another factor that significantly increases the likelihood of hemorrhoids. These dietary habits, by disturbing digestion and affecting blood circulation in the anal region, facilitate the development of hemorrhoids. What to do? Consume spicy or heavily seasoned foods sporadically, and during a hemorrhoidal crisis, do not consume these foods. 10. Excessive straining. Lifting too much weight at work or in the gym, for example, can lead to a significant increase in pressure on the veins of the anal region, possibly aggravating hemorrhoids. What to do? Avoid lifting too much weight whenever possible. But whenever you have to lift weight, you should contract the muscles of the perineum at the same time. 11. Regular physical activity. Regular physical activity plays a vital role in maintaining digestive health and in preventing hemorrhoids. Exercises such as walking, swimming, yoga, and Pilates not only help promote better intestinal transit, but also reduce pressure on the veins in the pelvic and anal region. Moreover, regular physical activity contributes to maintaining an adequate body weight, decreasing the risk associated with obesity and sedentary lifestyle. What to do? It is recommended to perform at least 30 minutes of moderate exercise on most days of the week. 12. Spending too much time sitting on the toilet. The relationship between prolonged time sitting on the toilet and the emergence of hemorrhoids is not direct, but involves the individual characteristics of the person. Generally, individuals who spend a lot of time in this position tend to exert more effort during evacuation. This additional effort is what favors the development of hemorrhoids, indicating that lifestyle and personal habits play a significant role in the health of the digestive system. Thus, it is important to consider hygiene and health practices to prevent problems like hemorrhoids, which are associated not only with position, but also with the effort made during evacuation. 13. Stress management. Stress can negatively impact digestive health and contribute to the development of hemorrhoids, influencing bowel habits and increasing muscle tension in the pelvic region. What to do? Stress reduction practices, such as meditation, deep breathing techniques, and mindfulness, can help relieve tension and promote better functioning of the digestive system. Moreover, seeking a balance between work and leisure, engaging in hobbies, and maintaining adequate social support are important strategies for effective stress management, contributing to digestive health and preventing hemorrhoids. How to treat hemorrhoids. The treatment of hemorrhoids can be done with simple measures like maintaining good bowel habits, For this, it is recommended to increase the consumption of fibers and reduce the consumption of pasta, increase water intake, and defecate whenever you feel the need. However, some home measures can help, such as sitz baths with warm water, some analgesic and anti-inflammatory medications, as well as hemorrhoid creams based on polycresulin and cinchocaine, for example, prescribed by a doctor. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.